oral formulations, the oral absorption, that is the mouth melt formulations versus the IV glutathione. Of course, there is no comparison in terms of bioavailability, because something that is directly being given into the blood is going to have 100% bioavailability. But the question comes about the convenience and the compliance, because not every patient would be willing to go with the IV formulation, and therefore the convenience and compliance issue is something that is very important once we are giving a molecule which is to be given for the long time. It's not just we give a molecule and then we forget about it for a few months. We have to give it on a regular basis. So compliance and convenience is something where these formulations scores much better than the IV formulations, and of course the cost implications. So the IV formulations are priced at a higher rates as compared to these oral formulations, but more or less the bioavailability is very good, the first pass metabolism is avoided, and the onset of action is good with these oral formulations. I'll end my talk with some of the clinical studies that has been done, and particularly with the liposomal glutathione, and a large number of studies are available now with us, which does state that as compared to the other form of formulation, the liposomal glutathione does increases the cellular uptake of this particular glutathione. The peak levels are achieved much faster, and it has got a better safety profile as compared to the plain glutathione. Now this is another study where they do suggest that when you are delivering these molecules through the oral mucosa, the glutathione absorption is augmented as compared to the GI tract, and therefore it is suggested that the oral routes are much superior to the conventional ways of delivering the glutathione. Another study where the oral supplementation with liposomal glutathione is known to elevate the body stores of glutathione, and therefore it is can be used as a marker for immune function. So the key takeaways is that delivery definitely determines the efficacy. Whatever is reaching into the systemic system is something which is going to kind of give you the results, not just the dosage in the oral formulation. Oral buccal route is a promising route. We have seen it